welcome to my message for February. The first thing I want to talk to you about this month is the new report that's been published into the future of mental health over the next 5 years. You may have seen this in the media, lots of coverage this week, but I wanted to tell you the key points that are in there. Now, really importantly, this report recognises that mental health services have been underfunded for many years and that more resources are needed. The report says that it thinks that it needs an extra £1 billion is required to be spent across the country by 2020. The government have committed to this, and it's important that we make sure that these resources do reach frontline services and that services improve as a result of this. So it's a big report, there's lots of recommendations in it. There are 4 ones that I want to bring to your attention and just talk a little bit about. The first one talks about the fact that people need to have access to crisis services and home treatment services 24/7, so that's 24 hours a day, 7 days a week. In the same way that we expect that services are there if we've got a physical healthcare problem, then they should be there if people have got a mental health problem. It also talks about more should be done to prevent suicides, and it sets an ambition that by 2020, 10% fewer people across the country will take their own lives. And there's a lot more detail in the report about this, but it highlights the importance of crisis services in how we prevent suicides. It also recommends that there are more services in place to really improve the physical health care of people with a serious mental illness, and we know that this is a real need across the country. People with a serious mental illness die on average 15 to 20 years sooner than somebody without a serious mental illness, and that's a real gap in health inequalities that needs to be closed. So the report recommends that there should be a greater investment and more services to provide talking therapies for people with anxiety and depression, and a lot more access to these in primary care and not just in secondary care services. So another area that goes into great depth on in the report talks about a real fundamental change in the way that services for children are commissioned and are provided, and sets a target that there needs to be at least 70,000 more children should be able to access to care when they need it. Some of the services that it talks about we've already developed and done within this organisation, but there's a big section on children's services. So the final bit that I want to highlight to you in the report, a major bit of this report, is the requirement that people who need to access beds are not placed in a long way from where they live. And this is something that we've talked about in messages before. It's something that we're working really hard to stop within the organisation, because if people need access to beds, people who need admitting, they need to be admitted close to where they live. So I welcome this report. It's got lots of things in it that will really take mental health services forward if these things are introduced and if the funding follows this, that we can expect a big improvement in services. The full report is on the intranet, and I'll get you some more briefing and information on this over the next couple of weeks. So the next thing I want to talk to you about again is the forthcoming Chief Inspector of Hospitals visit. As you know by now, this starts on the 14th of March. Lots of work that we've been doing in terms of preparing for this. Not just making sure that we are in a really good shape for the inspection, but in a great shape and services are good continually. So we've developed a couple of briefing packs and guides to help you prepare for this inspection. You should have received these now. There are 2 books here. There's one here which is a staff briefing pack, tells you all about what will happen in the inspection, where to find more help if you need it. And the second one is a little self-assessment guide, which is helpful for team managers and staff to go through some of the questions that the CQC may ask you. So if you haven't already got one of these, and they should be available for everyone, please contact Communications. They will be able to give you one of the documents. The CQC at the moment are finalising their preparations, and we can expect some unannounced inspections to start probably in over a week's time. The full announced inspections start in the week beginning the 14th of March, and we'll be advising teams as soon as possible when we have any information from the CQC about when they will expect a visit. The CQC also want to meet as many staff as possible, so in addition to team inspections, they will hold a series of focus groups on the Wednesday, so that's Wednesday the 16th of March. And these focus groups are open to all Trust staff, but you can only attend the staff focus group that's relevant for your role. So there'll be information on the intranet about when that is. If you need extra staff to be able to access one of those focus groups, your manager should make sure that that's available so that you can attend those. So my key final messages to people really are: be ready for this, make sure that your training is up to date, particularly your mandatory training. We had a major fire in Wandsworth Recovery Centre last week, and the fact that people's fire training was up to date, I think, played a major part in making sure that nobody was seriously injured during that fire, and that everyone was evacuated safely. So if you're a clinician, make sure your care plans are all up to date, that patients have been involved in developing those, and that there are crisis plans where appropriate for people who need them. We will have more mock inspections next week on the Thursday the 25th of February, and expect to see a lot of you out and about when we're coming round and visiting services. So I think my final thing to you to say is be proud of your services. You've got a lot to be proud of. There are some really good services here. Make sure that you tell the CQC this. There are comment boxes that the CQC have placed around the site now. If you've got comments to make, put them in those comment boxes, and that they will be able to see them. So over the last 6 months, we've had about 300 people, members of staff, carers, members of the public and patients have attended a series of workshops that we've had that really looking at what our values of the organisation should be. And as a direct result of that feedback expressed, we've now created values that we think are more relevant, meaningful and representative of our organisation. And alongside these values is a framework of behaviours that make it clear, really for the first time, of what we expect from all staff and what we don't expect. So our new values are making sure that in everything we do, we are respectful, we are open, we're compassionate, we're collaborative, and we are consistent in the things that we do. Please don't be afraid to challenge people if they are not displaying these values. And over the coming weeks and months, the organisational development team will be looking at how we embed these values and behaviours in our recruitment, in our appraisals, in our training programme. There'll be lots more information available on the intranet shortly, but if you have got any concerns, please contact Alicia Molyneux in HR, or as I say, look on Insight for more information. Thank you for watching and listening to my message this month. As ever, if you have any questions or things that you want to raise with me, please contact me by email or stop me if you see me around any of the Trust sites. Thank you.